this news that Pfizer is going to put in their application for the conditional marketing authorization is very, very welcomed. We're all ready.
The monotherapy, the antibody can be used on its own, has already been granted an emergency use authorization in the US, and it's already being used and distributed through the US government.
So isn't it interesting that we had that big acceleration earlier this year, and it was dealt with through really massive movement restrictions? The number of cases reduced dramatically.
We need to manage expectations because it's still relatively early between now and when we eventually get the vaccines for the public.
The global response to the pandemic has been completely stifled by questions of sharing data. And none of us, including governments, can afford to ignore this problem anymore.
I hope everybody, not only the industry, but also the member states and the Commission use the time to really make it happen now next year in May.
There are many other areas where we could do more as Europe. We have some great examples. We have regulations that have worked fantastically, like the orphan medicinal product regulation. In 2000, we had like 8 products on the market, and now we have 184.
The strategy which we found was the best for Sweden to try to tackle the situation, to try to fight the virus.
But we also have to look at survivorship.
The orphan regulation absolutely did help, but not fast enough.